Good afternoon, ladies and gentlemen, and our dear followers. Today is my post-operative day 15. Well, as everybody can see, I think that the growth rate of the graft is absolutely amazing. I just want to explain a little bit about what I've confronted in the post-op period. I think this will be very helpful for our patients. Because I experienced it not just as a doctor, as a physician, as a patient as well. So basically in the first 4 days, everything was numb and I didn't feel any pain at all. And I can tell you absolutely the procedure was pain-free, 100%. Although I had another different procedures. Don't look at my swelling. My swelling is because I had some fat grafting and some stem cells here for facial rejuvenation. So please do not mix both procedures together and say that the doctor has that much swelling among their eyelids. So that's a different procedure. It doesn't have any relationship with my hair transplantation. I think one of the most distinctive issues that I've witnessed is that because we did the procedure with stem cells, which is basically a privilege for our patients who would select the iPro package, I think so. The iPro and iHair Pro and iHair Plus has those privileges, and I can say that absolutely I would recommend it 100% because what I've witnessed that you can see that the cuticles are regrowing very fast. So first of all, we have to discriminate what we're meaning about cuticles and what we're meaning about the root or the follicle bulb itself. Now we know that a hair follicle is an organ, it's not a cell. And it constitutes a population of cells that are engrafted inside the hair-bearing area of the scalp where the tunnels are being created during the hair transplantation procedure. So when those grafts are uptaked and they manage to survive, which I can see and witness that the majority of my grafts has been survived, lucky for me. Of course, the meticulous job and the skillful job that the team did. My graft quality index was 1.88. Actually, the patient before me had a better graft quality index than me, but anyhow, it was below 2, so I was on the safe side. And I can say that the stem cell definitely works amazingly, and I can witness it as a physician as well as a patient. Now, after the 4 days of numbness, I can say that you can experience pain. So please, I kindly recommend my patients to fit to the protocol that we've invented together with Dr. Tarek regarding our, aftercare. So please, if you regularly take your painkillers, it's going to be very helpful. Don't be deceived that you would not have pain in the first days, because when the pain cycle starts, if you don't interrupt it, and then you might experience pain afterwards for the following 6 days. So in order to avoid that period and make it pain-free as much as possible, please fit to the recommendations that we've advised you through the protocol that we provide you in the aftercare process. Nevertheless, of course, your life habits are very important. I don't smoke at all. I don't drink alcohol, but I work hard. I'm a surgeon. I have very active surgeries, and I started to do surgeries just 2 days after the procedure. But I try to fit myself in terms of making my sleep regular as much as possible. I know it's summertime, but in summertime, I can say that was not that difficult, even though there was quite a, let's say, considerable amount of heat that we had here in Istanbul, but nevertheless, it was fine. Now, I want to talk about something else that I think you guys have to fit into as well, is the preparates and the products that we're providing you. I think you have to use it regularly and in a strict fashion, which I did myself, and I'm witnessing that. I believe that definitely it will help a lot. I was very strict on my vitamins. I'm taking my vitamin B complex because we know that scientifically that the B complex affects the cuticles. The cuticles are the hairs itself. So the growing of the cuticles, as you can see, the growing rate is quite amazing in my grafting area, as well as in the donor area, and actually the overall growth rate is very high. And of course, the solutions that we're using especially the foam and I think this is called the spray foam or the lotion. This is a lotion, the foam lotion. There's a shampoo and this is the foam that you just, just take a bit of hit like that. Sorry. It's like whipped cream. So you just rub it over your skin. It makes you feel much better. Actually, it removes the stiffness and the cracking feeling and the tenderness, and it makes it more smoother. And moreover, it smells quite well. So it gives you a refreshment. And beyond that, it has the components that helps to grow the cuticles. Nevertheless, we're gonna follow up with this video in the following months. I will keep you update with my experience during this, let's say, 6-month period, right? And see how it's going to progress. And I will definitely share my outcomes frankly and decently to you. And I hope that this experience is going to be very helpful for those who want to come and take their experience for hair transplantation in Karaaltin Hair Clinic. Thank you very much. And before we finish the video, I just want to thank my crew. They were amazing. Dr. Tarek, you were amazing with your assessment, and Junaid, our assistant, because they designed the hairline together with Tarek and Taha. And we're very happy. I'm very happy at the moment. And hope to see you soon next month, and we'll see what is happening. I'm just wondering if we're going to witness some shock loss, which is absolutely natural, but I may not witness that. And I just want to tell you another hint. I'm going to start to use something called the AQ solution with a derma roller, and I think it's very effective, and we as a clinic we recommend to use it. So I'm going to use it as in 3 packs, 3 protocols, and I'm going to share that outcome as well with you. And let's see how the cuticles are growing and whether we're going to stop the shock loss from happening at all. If I manage that, I think that's going to be a big turnout in the progress, because when you have a shock loss, you have a period of anxiety that you might feel that you're not going to regain those hairs, although you're going to regain it anyhow. But if somehow we can cut that period off and make it very short, I think it'll be amazing, and I will hope to share you all with that. I think some of our patients that had the stem cell, they didn't witness shock loss, right? At all. Some of them, they didn't witness it. I think because it's a combination of attitudes. If you strictly obey to the ingredients that we recommend, and if you don't smoke and your lifestyle is quite okay, and if you fit to the supplements, I think those patients would definitely have a better outcome and improvement of not witnessing shock loss.
The rate is, considerably low.
Okay, we'll see about that in the following months. So thank you very much. And I think that you can give me a close shot to the graphs if the patients and our followers would will to see and see how they're. Okay. Okay. So thank you very much and see you soon. Bye.